Good evening. My name is Crystal Reyes, and I'm here to discuss the Neighborhood Services Organization Substance Use Treatment Program. According to findings published in September of 2018 by SAMHSA, the Substance Abuse and Mental Health Services Administration, approximately 3.4 million Americans, young adults between the ages of 18 and 25, had alcohol use disorder. Another 10.6 million adults over the age of 26 met the diagnostic criteria for alcohol use disorder. This information, I'm sure, is not shocking. In fact, it's estimated that in any given year, more than 15 million Americans met diagnostic criteria for addiction. According to a study funded by the Michigan Health Endowment Fund, 638 Michiganders are experiencing a substance use disorder, with only 20% receiving treatment. The goal of this project is to implement a substance abuse treatment program within the current infrastructure at Neighborhood Services Organization. This year alone, there has been a 224% increase in the number of overdose deaths within one program at NSO, or Neighborhood Services Organization. Although not every individual with a substance use disorder will receive help or want help, nor will we be able to save or prevent every overdose. The objective of this program is to provide individuals with accurate and timely assessment of their substance abuse disorder and offer evidence-based interventions and deliver multiple layers of recovery support. In this project, I worked with Neighborhood Services Organization, which is a 5013C. We're located in Detroit, Michigan. Established in 1955, our mission statement is to strengthen communities through bold outreach services and holistic programs for vulnerable populations, changing lives one person at a time. At NSO, we aim to provide compassionate and professional services that impact countless children, youth, adults, seniors, families, and communities. Our vision is to be the premier provider of holistic care in the communities we serve. We have an array of services right now. The programs that NSO offers are community outreach for psychiatric emergencies. We offer services for homeless recovery and for housing insecure persons, services for adults with severe and persistent mental illness, along with a series of programs for those who have developmental disabilities and older adults. We take a holistic approach to address social determinants that affect health, education, economic stability, and in 2020, we opened up our first Neighborhood 360 Wellness Integrated Health Clinic. The plan is to create an evidence-based substance use treatment program within the current infrastructure of Neighborhood Services Organization. What I did during this project is to create a work group to begin to develop a substance abuse treatment program within NSO. We identified payers, so commercial payers, we're fee-for-service, so we identified payers such as commercial payers, Medicaid, Medicare, and then created those billing codes or determined what those billing codes that we could use in order to bill for substance abuse services. NSO is an already established mental health agency, which means that we already accept commercial payers, Medicaid and Medicare. However, we needed to reorganize and realign all of our policies, our intake, assessment, referrals, evaluations, and then all of our procedures and policies, such as consents, releases of information, etc., to include substance abuse program language. Next, the objective was to create a seamless referral process. So although there's a multitude of services that NSO offers, none of them are substance abuse. And so the goal was to identify processes that were established through NSO so that current clinicians and case managers would be able to seamlessly streamline those patients or those consumers that needed substance abuse services over to our program. Next, we needed to reestablish the NSO Substance Abuse Treatment Unit. So years before, NSO did provide substance abuse treatment services, and so we needed to go back into our finance log and work with the finance committee to pull that unit out and reestablish it, which meant create intakes and assessment charting tools and add them to our current health record, electronic health record. And then finally, once we have that established, we were then tasked with recording and tracking all outcomes. So at this point in the project, we were able to create a metrics that allow for us to pull out of our electronic medical record. We were able to pull out 360 consumers within neighborhood services organization that are receiving services that fit criteria for substance abuse treatment. So using those identifying markers within our current EHR, electronic health record, we were able to determine the consumers that needed services and then outreach that particular pool of folks. As far as the budget is concerned, because we're our fee for service, our budget was $45,500 for salaries, wages, which would constitute one certified peer support specialist. Now, the overreaching goal of this program is to create a sustainable project. And as I told you before, we have 360 consumers to start with. The goal is to be able to increase that. And so to start off, we'll have someone certified peer support specialist. And as capacity increases, we will be able to then increase our staff. Licensing from the state of Michigan is $500. Office supplies, including pens or pencils, any type of mileage or travel that may need to be reimbursed. Equipment, which is one laptop, charger, and cell phone for the one staff that we have, came to a total of $47,750. Our outcomes were a four-pronged approach: to increase access to addiction and recovery support services, to increase access to medically assisted treatment for those that suffer with opiate use disorder, to establish a culture of treatment and recovery within NSO, and to increase revenue within the NSO organization. It was a pleasure. Thank you.